Your chest doesn't explode. There's no dramatic clutch and fall like in the movies. It starts quieter than that. A pressure, a tightness. Like someone parked a truck on your sternum and forgot to take the keys out. Your jaw feels weird. Your left arm feels heavy. You're sweating, but you're not hot. And the worst part? It's the end of the world. No hospitals, no ER, no paramedics sprinting in with a defibrillator and a bill that ruins your credit score. Just you, a failing heart, and a clock that does not care how prepared you thought you were. Let's try to beat that clock. First thing you need to answer, fast. Is this actually a heart attack or something that just feels scary? Because panic attacks, acid reflux, and muscle strain can all cosplay as a cardiac event. But during collapse, you don't get the luxury of perfect diagnosis. You work with probabilities. A heart attack usually comes with chest pressure, not sharp stabbing pain. It can radiate to the left arm, shoulder, neck, jaw, or back. There's often shortness of breath, nausea, cold sweating, dizziness, or a sense that something is very wrong even if you can't explain why. If the person says, "I think I'm dying," and they're not the dramatic type, listen to them, especially if they're older, a smoker, diabetic, overweight, stressed, or already have heart issues. This is not the time to play tough guy medicine. Now let's talk about what actually helps, because most people waste the first critical minutes doing nothing useful. Step 1, stop all activity immediately. Sitting down is not enough. You want them resting, ideally semi-reclined, head and shoulders supported, knees slightly bent. Movement increases oxygen demand, and oxygen is the one thing the heart is currently failing to deliver. Calm matters here. Panic spikes heart rate and blood pressure, which makes everything worse. You don't tell them, "Calm down," like an idiot. You slow your own voice. You control the room. You become boring and steady. Next question. Do you have aspirin, not herbal tea? Not garlic. Actual aspirin. Chewed, not swallowed whole. Chewing gets it into the bloodstream faster. Aspirin helps prevent further clot growth, which can be the difference between partial damage and full shutdown. If the person is allergic or actively bleeding, obviously don't do this. But if you have aspirin and no clear contraindication, this is one of the few real tools that actually moves the odds in your favor. Now let's talk about what not to do, because people get creative in the worst ways. Do not give alcohol. Do not give energy drinks. Do not force food. Do not make them walk it off. Do not perform chest pounding, coughing rituals, or TikTok CPR hacks while they're still conscious and breathing. CPR is for when the heart stops, not when it's struggling. Premature heroics can tip them over the edge. While all this is happening, you're watching for deterioration. Is their breathing getting more labored? Are they turning pale or gray? Are they becoming confused or unresponsive? This matters because the moment they lose consciousness and stop breathing normally, your entire strategy changes. At that point, you're in cardiac arrest territory. That's when CPR becomes the move. Hard, fast compressions in the center of the chest. Depth matters. Consistency matters. And yes, this is exhausting and ugly and violent looking. But at that stage, you're already gambling with death, so politeness is off the table. Now here's the brutal part that nobody likes to talk about. In a real collapse, survival odds for a major heart attack are not great. Even with perfect response, modern survival depends heavily on rapid hospital intervention. Clot-busting drugs, catheters, surgery. Without those, you are not curing the problem. You are buying time. That's it. Your entire goal is to reduce strain, slow damage, and keep the person alive long enough for either delayed medical help or partial recovery. If the person survives the initial event, the danger is not over. The next hours to days are critical. They need rest. Absolute rest. No, I feel better. Let me stand up. That's how secondary cardiac events happen. Hydration matters, but don't overdo fluids. Keep them warm, but not overheated. Monitor for worsening pain, increasing shortness of breath, fainting, or irregular breathing. Any of those can mean complications like heart failure or lethal arrhythmias. And let's kill one more myth while we're here. Nitroglycerin is not magic. If you have it prescribed and know how to use it, fine. But popping random heart meds without understanding blood pressure effects can drop someone into shock. This is not a scavenger hunt medicine cabinet situation. So let's recap, because when stress hits, memory disappears. 1. Recognize the signs: chest pressure, radiation, sweating, nausea, doom feeling. 2. Stop activity and position them to rest. 3. Calm the environment and the person. 4. Chew aspirin if appropriate. 5. Do not give dumb remedies or force movement. 6. Be ready to switch to CPR only if they collapse and stop breathing normally. 7. After survival, enforce rest like your life depends on it, because theirs does. A heart attack during collapse isn't cinematic. It's slow, frightening, and deeply unfair. There's no reset button, no ambulance siren saving the day, just preparation, restraint, and a little bit of luck. Stay alive, my friends, and may your heart keep beating even when everything else stops.